presenting a very small topic, instruments to treat mental disorder. Next slide, ma'am. Next slide, please. Yes. So manifold high-tech eye-touch approaches have been evolved in psychiatry, especially to treat many mental disorders like schizophrenia, bipolar affective disorder, anxiety, dementia, autism spectrum disorder, stress, alcohol dependence syndrome, even many, etc. Next slide. Yeah. This scientific review paper includes instruments like transcranial magnetic stimulation, ECT, biofeedback therapy, aversion therapy, light therapy, galvanic skin response, virtual reality therapy, bedwetting alarm, chatbot, the external trigeminal nerve stimulation, robotic pet therapy, robot-assisted therapy, pills, computerized dermatoglyphics, microchip nanosensor, smart devices, human stress monitoring, smart patches, and electroencephalogram, EEG. Next slide. Okay. This paper comprises of its uses and responsibility of the healthcare worker by handling these eye-touch instruments to treat mental disorders. So here I'm about to present each and every instrument separately, along with the history, name, of course, how far it is useful in the treatment, and along with the picture I'm presenting here. And of course, all healthcare workers are a responsibility. Next slide, ma'am. Yeah. So no, the slide is very small, and I'm unable to read also. Okay, no problem. No problem. Still I can make it out. So here, if you could see, can you see the picture, all of you? Is it clear? Yes, I suppose it is clear. See, some long back, we have been treating mentally ill patients like those who don't respond to drug. We put patients under antipsychotic, antidepressant, and all mood stabilizers, anti-anxiety drugs. And basically, for a long time, if you put, like, we divide doses into three, like initiation, stabilization, and maintenance dose. So when we put patient under maintenance dose for a long time, like 3 years, 4 years, and 5 years, automatically their body will not respond for that particular drug. It's simply called as drug resistance. So in such case, first line of treatment is drug, and second line of treatment is ECT. We just shift the patient for ECT, electroconvulsive therapy. At present, many scientists, they say that better not to take patients for ECT because there is no exact mechanism which we can understand scientifically. Like a few scientists, they say that it is because of there's a heat or to say fire in the pathway, catecholamine pathway, like dopamine, norepinephrine, serotonin, etc. And after long research, it's a research journey, actually speaking. After long research, many scientists, they say that you can go for transcranial magnetic stimulation, especially for depressive clients. So it was first discovered in the year 1985, very nearby. See, Anthony Barker and its colleagues, they just invented this transcranial magnetic stimulation. You can observe the picture. See, that lady is just lying comfortably, and on her forehead, just electromagnetic waves has been placed for 30 to 40 minutes, and the patient can receive TMS for 5 days a week. See, it's nothing. The basic science is very simple. The thing is, we'll just place a magnet in the frontal lobe, prefrontal lobe especially. The thing what we should understand here as a healthcare worker, in the sense, the magnetic waves will have its own impact on the biochemical changes in the brain. Automatically, depressive symptoms will drop. And you can see the picture, see how far it is. And the users, again, just now I just brushed the users. It is very useful for scaling down the depressive symptoms, and healthcare workers' responsibility. It can be like they can make out the parameters like the motor threshold level, stimulation, duration, frequency, or the scalp location. The number of pulses can be for duration. All this can be consulted with the technician, and of course we can make this for that particular depressive client. And informed consent is very important. We should obtain from the client. Of course, assent is also important. If the client is really very depressive state, you can get assent from the relatives. And next slide, please. Next slide. Yeah. So this would have come across the term electroconvulsive therapy. So basically electroconvulsive therapy, it's very old, and at present in India we practice. Many countries, they follow transcranial magnetic stimulation. So Binney and Serletti in the year 1938 April, they just invented this electroconvulsive therapy. You can observe the patient who is really receiving electroconvulsive therapy, and ECT machine is very nearby to him, and BP cuff has been put, and he's again connected to oximeter, and ECG is monitored, and intravenously is receiving. You can observe the picture, I suppose it is vivid. Again, he will be receiving atropine, thiopentone, and succinylcholine before giving ECT. It is just a muscle relaxant. Why we put atropine in the sense, just to prevent vagal nerve stimulation, and of course to prevent cardiac arrest also. And at present we follow, in Indian setup also we follow occluding method. What is occluding method in the sense? We just place patient in a comfortable position. We give atropine and thiopentone. We don't give succinylcholine. Before giving succinylcholine, because succinylcholine is a complete muscle relaxant. So before giving succinylcholine, we tie BP cuff very tightly in either upper or lower extremity of the client. And after tying very tightly, we give succinylcholine. Automatically, that muscle relaxant will not pass in that particular extremity, because it is tightly has been packed with BP cuff. So when you give succinylcholine after tying BP cuff very tightly, so when you could give some ECT waves or electrodes, with the help of electrodes, when you give some electric shock to the patient, what will happen? Seizures will develop. Basically, all parts will be very relaxed, and we cannot observe seizures. Generalized tonic-clonic seizures we cannot observe. Only the part where we just put tight BP cuff alone, we can observe generalized tonic-clonic seizure for 20 seconds. And coming to the uses, and it is really useful for severe depressive patients, of course, schizophrenia and mood disorder clients. It could be like depressive, very severe depression, or acute manic phase. We just put an intractable mood disorders also, we put under ECT. And nowadays ECT is highly recommended for pregnant women. You all may wonder. So many say that it is not advisable for pregnant women, but at present we give for even for pregnant women also. And you would have come across the term artificial pacemaker. So in some previous long back, like some 1 decade or 2 decades, like 20 years back and all, we were very afraid to give for artificial pacemaker clients and all. But at present we give much more ECT for, we give at least, we weekly thrice we put under ECT even for artificial pacemaker clients. In the sense, we'll call cardiologist. He'll come and attend the client. He will deactivate the SA node, artificial pacemaker node, for a while. And after giving ECT, again he'll activate. It is like patient controlled and of course surgeon controlled. Artificial pacemaker nodes. And it is again much more useful for treating all patients, and it is very much what to say, it improves 70 to 90% of the patient. And pre-treatment ECT care can be like, you can monitor vitals, therapeutic collection can be done, and nil per oral at least minimum for 4 hours just before starting the ECT, or overnight fasting is advisable. And we should empty the bladder, and napkins, bracelets can be removed. Why? In the sense, because all these are conduction of electricity. And intra-treatment care in the sense like you can monitor the voltage. Voltage is actually calculated and decided by the ECG technician, of course, doctor. Other healthcare workers also can involve. And you can apply BP cuff and you can connect all the pulse oximeter and monitor the voltage. And you can make observation of conversions, generalized tonic-clonic seizure. Basically, we do suction and we place mouth gag to prevent tongue bite also. We document the findings, and post-treatment care can be, we can record all the vital parameters. Along with, we can make the patient to lie in side-lying position to rule out all the saliva and secretions. Next slide, ma'am.
Biofeedback, it was invented in the year 1969. And basically it is a small instrument where we practice in clinics. It is a painless sensor, basically placed in the index or middle finger, and it is connected to a monitor, which is again a computerized or a simple monitor. And it can show our own heart rate, our respiratory rate, our muscle tension, temperature, BP, everything, all basic parameters it will just show. And after watching the parameter, if the indicator is in red, we can sense that we are much tensed and we are really under much stress and tension, of course, anxious state also. So at once we recommend the patient, we suggest patient to go for deep breathing. Why? In the sense, see, when we are stressed and when we are in anxious state, basically our oxygen level in our body will be very, very less. So when we take deep breath, when a lung could supply oxygen to the whole part of the body or whole body, what happens? Here our mind gets relaxed and stress level will drop and anxious level will drop again. For that basic science, we make them to practice deep breathing and progressive muscle relaxation along with guided imagery or mindful meditation. So that's a picture I just want to show here. It is very basically used for anxiety or anxious patient or depressive patient, of course, chronic pain syndrome and sleep disorders. Yeah, and the parameter will flow from red indicated to green, yellow. If you're really okay after getting deep breathing or after practicing deep breathing, if you're really okay, the indicator may pass from green to yellow and finally to from red to yellow and yellow to green finally, so that you're really completely relaxed without any stress. Okay, next slide, ma'am. This is aversion therapy. You can observe a mission here. You all can observe. See, this is basically a very good mission. Was formed in the year 1930 in United States. Just to cure alcoholic patients, basically to cure alcoholic patients, of course, and later they have used much more for homosexual individuals, and many scientists they use for many more mental disorders. I'll just brush up all those things also now here. See what we do, I'll tell the basic science or the psychology behind it. See, for many alcoholic clients, we have done this aversion therapy basically. See, what we'll do, we'll just make that particular alcohol bottle in front of him. So alcohol is a very pleasant stimuli for that particular alcoholic client. He loves to drink alcohol. So that is a very pleasant stimuli for him. What we'll do, we'll make him to think of alcohol. We place alcohol in front of him, the bottle. And it's a very pleasant stimuli. And here we'll give response as shock. Pleasant stimuli will be placed. We'll make him to think about the alcohol. And the response here, he immediately want to take that alcohol and drink. But still what we'll do, before he could drink, we'll give electric shock in the inner aspect of the palm, hand palm and leg sole. We just give very small voltage. We pass few current inside the or inner aspect of the palm and sole. So immediately what will happen, pleasant stimuli and unpleasant response will be there. Oh, it's painful. That sort of unpleasant response will be there. And automatically we will stop that response. We'll not give current shock after a long time. Like after 2 to 3 settings, we'll stop giving current. And this pleasant stimuli will pair with unpleasant response, and automatically pleasant stimuli will turn to unpleasant stimuli. That's a very, very basic science. It's just an association. Okay, fine. So it is basically used to treat alcoholic clients and cocaine and amphetamine. Amphetamine clients very much more we observe in clinical picture, and any self-harming behaviors like deliberate self-harm or like cutting, suicidal thoughts or suicide attempt, nail biting or compulsive gambling. All these clients we can just use as aversion therapy. And as a healthcare worker, electrical stimuli should not be used much because we pass only few very minimal electricity voltage, not more than we have some cutoff point. So see, sometimes it may cause some problem. So we just don't put under much more electric shock. So patients should be educated about all side effects also. Next slide, ma'am. Yeah. So this is light therapy, phototherapy, heliotherapy. It was first invented by Danish physician Niels in the year 1860 to 1904. So here it's simply a light therapy. It's a box actually speaking. Nowadays it is available in Amazon. You can just put an order in online itself. So just a light box. And here the voltage or the lux basically is 10,000 lux. We just put under 10,000 lux, we place in front of the client who is really suffering from seasonal affective disorder and symptoms. And of course, any mood problem or sleep problem, just what will happen in the sense, basic science here is, when you could place this light in front of the client, there is some biochemical change, impact in the brain's biochemical change. Of course, he is getting settled with all depressive symptoms and seasonal affective disorder. And that's just put in the uses. And again, in healthcare worker responsibility, it can be like 20 to 30 minutes daily. We can just recommend this sort of light therapy. Next slide. Yeah. This is galvanic skin response. You can observe the picture here. It can be otherwise called as electrodermal response or galvanic reflex or response. And it was invented by Ferry in some long back. And it is simply for emotional arousal. So when we are when we are undergoing some emotional arousal, what will happen? We can feel the sweat, or we'll sweat very badly. So out of that sweat, we just want to know how far the patient is undergoing, or how far he is feeling tensed, or is anxious, or how far he is in post-traumatic stress disorder problem, or how far he is literally suffering from schizophrenia or any other mood disorder. So it's a very good instrument, and it's like the electrodes or probe is placed in the palm. You can just observe, and really it is very useful for notifying all the changes which is happening in the during the time of anxiety in the sweat. So something I would like to throw here is, so basic stress hormone is cortisol. You all know that it is cortisol. So cortisol can be assessed in urine, in blood, in saliva, in tears, in ear wax also. At present, many scientists, they say that even in ear wax, you can assess the level of cortisol. So basically in blood, the urine, saliva, very common, we assess tears, in tears and in ear wax, and of course one more in sweat. It's very rare picture, but still many scientists, they recommend to just assess the cortisol level and stress hormone level with the help of ear wax and the other thing. And galvanic skin response can be assessed by two methods, basically exosomatic and endosomatic method. So endosomatic is not possible because it is just put inside the body. Exosomatic is possible because it is placed outside the body. It's just a machine. So direct current or alternative current will be passing through the circuit, so that exact changes in the skin, or to say in the skin sweat, can be read. The reading will be very accurate and correct. Next slide, ma'am. Yeah. This is virtual reality therapy or computerized cognitive behavior therapy. Again, my internet connection is not stable. Gazel ma'am, can you hear me?
Yes, Dr. Sampoornam.
Can you hear me?
Yes,
Yes.
perfectly.
Okay, fine. That's good. So this is virtual reality therapy or computerized cognitive behavior therapy. Was first invented by Max North. So you can observe a person, you're just putting, he's just wearing multi-sensory viewer, and this multi-sensory viewer will have a small theater. It is like theater only, actually speaking. How far we are just sitting in a theater comfortably and we are watching a movie, just like that. It's a theater environment. All sort of problems, like especially if you're an autistic child, or phobia, stress or anxiety, or dysmorphia, or post-traumatic stress disorder, for all these, everything will be programmed inside. It's like a theater. You can observe certain moving pictures, really educating you, stating also, or just giving you this solution to the problem. All the moving pictures, stroboscopic pictures, can be observed here. And it is basically, everything is computerized. That's why it's called a CCBT, or virtual reality therapy. It's very advanced, and of course in Indian setup also we practice in few well-fledged hospitals and high-tech approach hospitals, they follow. And see here, no therapist. That's a very, what to say, wonder, I could say. Even in those days and all, we just search for cognitive behavior therapists. We go search, we are in need of cognitive behavior therapists. But nowadays we do have computerized cognitive behavior therapy. We can sit in any place in any part of the world, we can receive therapy. It's high-tech approach. And empirical research should be done to know the clinical application of this particular virtual reality therapy. Next slide, ma'am. Yeah. This is bedwetting alarm. Yeah, we face many patients coming to our clinics saying that he's bedwetting at nighttime, daytime, all such could be a very big complaint of especially parents. So we take it in sense of making a bedwetting alarm, and many we follow in clinical picture also. It was first invented by German pediatrician. And what we do in the sense, we place sensor in the panty of that particular client. We advise them to place sensor in the underwear or the pant underwear or the panty of that particular child. And alarm will be placed in the forearm. So you can sleep very comfortably. Advance when the client is urinating or the child is urinating, when that particular urine touches the sensor, because it is placed in the underwear. When the urine touches the sensor, automatically alarm will just produce noise. So that it signals and it produces noise, and automatically the child will wake, and he can void urine. He can sense that he has passed urine, and he can change the mattress, and he himself, it has been instructed to change by himself, and it is a very good treatment protocol. For 2 to 3 months we put, and for 14 consecutive nights, if the child is really very dry, we just stop this treatment until like fortnight in the sense 14 days we wait for dry nights. So it is used to treat like daytime and nighttime aneurysms also. And here we should get implied consent from the parents, of course, children, because they may not feel that it is really making some harm to them. So they should be made to understand all these things, and the healthcare workers can maintain accurate documentation of this bedwetting alarm. Next slide, ma'am. Yeah, this is chatbot or talkbot. See the picture, how far it is looking good. So it was invented by Joseph in 1994, chatbot. So chatbot, it is nowadays very much useful in the field of psychiatry and psychology. Why? In the sense, because certain things are very sensitive, like sexual issues. See, basically we use chatbot for sexual issues, sexual history, all those things they'll not reveal. So they should have some trust over the counselor or the therapist. Unless or until they develop some trust for the relationship, they'll not reveal everything, or some private matters or sensitive matters. In such case, we use this chatbots. And this chatbots will be like it is like a very small, all apps will be installed, and it can be spoken, written, and with all visual languages. So all the problems can be just what to say, it can be just, ma'am, I'm audible? Okay, fine.
Yes, Dr. Sampoornam.
Okay, fine. Because I'm getting message frequently that your internet is not stable. It is unstable. I'm getting very frequent message. That's why
Don't
I would
worry.
like to confirm. Okay, fine.
Don't worry,
Fine.
I'll text you in
Okay,
case that happens.
Okay, fine. Or else you give me an alarm. Let me just know that. Fine.
Yes,
Oh,
definitely.
fine. So it's like chatbot. You can just talk to chatbot. Chatbot will give you some corrections, and it will let you know the problem, and it will give some solution to the problem. And it is highly useful to treat all depressive clients, of course, anxiety, stress. And nowadays we give psychoeducation through chatbot. See, those days and all healthcare workers will carry chart, or they'll carry very big posters with them, or laptop or something to just teach clients and all the patients in the ward. At present, we give chatbot to them. Chatbot itself could educate them very well. So healthcare workers can track the mood and patterns of thinking, behavior of patients with the help of chatbots. Next slide, ma'am. Yeah. This is external trigeminal nerve stimulation. So it can be like called as ETNS. So in US, United States of America, Food and Drug Administration, they just recommend this for attention deficit hyperactivity children. So like children between the age group of 7 to 12 can be put under this TNS. So what this TNS, it is a very small instrument. And what this TNS will do in the sense, or it will help in the sense, electrode will be placed in the like temporal or in the frontal lobe of the child throughout the night who is really suffering from attention deficit hyperactivity disorder or any other sleep problem. Or it can be like throughout night it will be placed, the child can sleep very well, it can enjoy the sleep, nothing will happen. What the exact science behind it is, it will stimulate the trigeminal nerve, which is just in the forehead, of course, in the temporal area of our face. So in that area, if you place the probe or the electrode, it can pass the electrical waves inside the brain, so that the patient is really tapering the symptoms of, or the child is really tapering the symptoms of attention deficit hyperactivity disorder. Of course, for depressive clients, epilepsy clients, post-traumatic stress disorder clients also it is useful. See, you can observe the picture here. It has been placed in the forehead and connected to the small device. Stimulation is really for 8 hours throughout the night, is enjoying the good sleep also. So it can be monitored for all any drowsiness or increased appetite or trouble sleeping. Sometimes many patients, they report trouble sleeping, some teeth crunching, and headache and fatigue also very common. Next slide, ma'am. Yeah, this is robotic pet therapy. So see, robots are nowadays replacing human or manpower. Really, it's very surprising to the field of to the scientific field. And robotic pet therapy was invented by Ashpro Fabre in the year 1998 and Sony Ibo in the year 1999. And for dementia patients, usually we recommend pet therapy. In those days and all, we used to put under pet therapy, we admit client to bring pet from their home. They'll bring many pets from their home. It could be like a lovebird or a parrot or even a simple dog or a cat, or they'll bring from home. And certain pets will be inside the hospital itself, so that they can select pets they can enjoy. All those pets will be very much tamed. It is no more harm. It will not bite or it will not pick out. Nothing will happen. It is that much good to, or it is that much friendly to human being. It will be trained in such a way. But at present, no more real animals or real birds. At present, we give it with robotic therapy, robo pet therapy, robo. See, the picture which I've shown here is really a robo dog, robo cat. See, the dog also you can identify it's really robo, but this cat you cannot identify it's really a cat robo. So it increases decreases the elderly dementia patients or anxiety, stress, isolation, and of course, psychoactive substance use disorder and pain medications also. So before and after robotic therapy, as a healthcare worker, you can check the skin temperature, muscle tension, heart rate, or even the breathing pattern using biofeedback sensors. So after giving this robotic therapy, it's like pre and post test. After giving this robotic therapy, you can just observe whether this skin temperature, muscle tension, heart rate, and breathing, everything has dropped down or it's back to normal. Next slide, ma'am. Yeah, this is robo-assisted therapy. See, some long back, speech therapy, we seek for speech therapists. We seek like anything. Speech therapists and all, it's very rare to see, and they'll come to clinics, they'll give speech therapy. They help all autism clients, of course, those who really suffer with speech problem. But at present, we don't recommend speech therapists. We recommend robotic assisted therapy. Of course, in many foreign countries, not in Indian setup, many foreign countries and all, they practice this robotic assisted therapy. And this robot will teach how to speak. And this robot will teach how to have eye contact for autistic children. You'll not believe this. Robo will talk to the client, to the autistic children to see the eye, how to maintain eye contact, how to talk, how to make few words, and how to make sentence, how to make paragraphs. Slowly it will teach. So it is highly useful for autistic children. You can observe the picture here. And before and after robotic therapy, healthcare workers should assess the level of social skills and speech output in children with autism. It could be a very big assessment for autistic children. Next slide, ma'am. Next slide, ma'am. Yeah. So digital pills or smart pills are available nowadays. It's no wonder 2017 USA, they've discovered like digital pills and smart pills. So we need not be at the back of patients to put or take any antipsychotics, antidepressant, mood stabilizer, or anti-anxiety. We not be at the back of patient. Just like that, you can give it, and it's a digital pill. So digital pills will be designed in such a way that outer coat is made up of copper and magnesium. It is a coated area, metal coated area, and inside there will be indigestible sensor. This indigestible sensor, at once when it reaches the stomach, it will send message to sensor will be placed in the forearm. You can observe the picture. The lady is taking medicine. You can observe the picture. And here, at once, when it reaches the stomach, at once the copper and magnesium will just dissolve, because it has to dissolve. It is a metal, it will dissolve. But indigestible sensor will not dissolve. It will be there, and it will just send message to the patient, doctor, nurses, or any other healthcare worker who's directly connected to the patient care. And everybody will receive the message that this time, this patient has received from this location, he has received this sort of medicine, antipsychotic, especially second generation antipsychotic he has received. This sort of message you can observe, and next day morning, or when he defecates, that indigestible sensor will be out of the stomach. That you can make sure of that also. You can collect history from the patient. So healthcare workers must track the patient through smart phone app. Next slide, ma'am. Yeah. Computerized dermatoglyphics. Yes. Let me throw one question. It's a very simple question. Can anyone tell me that with your fingerprint, can you tell me that you're mentally ill or mentally healthy person? I've thrown question, no answer from this side. Can anyone tell?
As for now, no, I haven't heard anything like that till now. Let us ask others too. Dear attendees, have you heard anything like that?
We only saw it on movies, but we don't know if it's true or not.
Okay. What about others?
Does it actually exist?
Miss Fatima, we are absolutely gonna get answer from Dr. Sampoornam.
Yes, I'm here to explain the context. Yeah. This fingerprint interpretation is simply called as dermatoglyphics, right? And nowadays, we don't practice general dermatoglyphics. We practice computerized dermatoglyphics. You can just place the finger in the computer or the sensor of the computer. It itself can give reading that stating that you're having any schizophrenia, depression, autism, Alzheimer's disease, or mental retardation, dyslexia. So it's no wonder a fingerprint and handprints and prints can literally tell that how far we are mentally ill or not. It is purely used in the field of forensic psychiatry because there is one rule called Mag-Norton rule. Many escape from this Mag-Norton rule. They say that I'm mentally ill, I've attempted, I've assassinated a person, I've done murder. So I'm mentally ill out of my own thing, I've done it. Or I really terribly am suffering from delusion, I've done it. No. At present, we go for a fingerprint. Even in India, we follow the same in forensic department. Fingerprint can read and tell really the patient is suffering from schizophrenia or not. If it says yes, really he should be treated. If it says no, he should not be treated, he should be jailed again. So this sort of forensic psychiatry advancement we just practice nowadays. And of course, forensic healthcare workers can also make some subgroup patients just to follow. And we should explain the context, really what is happening, how far it is giving the reading. So when you could observe your, inner aspect of the hand or the finger, you can observe some cues, some creases cues. The creases cues when it is very high, normally those days they read it as mental illness, but at present computer can read thoroughly more than a manual practice. Okay, next slide. Next slide. Yes, this is microchip nano sensor. See, at present we are very hiking in science technology. Nano sensors were available. It's like it was just found by many researchers. And what do they say in the sense? It's like a fabricated glass. It's just a piece of glass. You can observe the picture. It is very clear. And when you could make a prick in the hand, and you can, with the help of lancet, and you can make one drop of blood on the fabricated glass so that you can observe. You can just, it's a blood sampling technique only. We not take the patient to take the blood and send with the help of vacuum cleaner. We not send to lab and wait for a couple of days to get the result. All these or those days we practice, but still at present we can make just a prick and make blood, and just making on the fabricated glass, you can observe the blood cortisol level, especially. So it detects the stress hormone from the drop of blood. Yeah, it's no wonder. Just now, some 3-4 slides before, I just explained cortisol can be measured in many areas in the body, like your urine, your blood, your saliva, tears, wax, etc., etc. So here, the cost is very low. You all may wonder what could be the cost. The thing is, here the healthcare worker should explain the cost is very low. So it is very accessible and available. And it is very ready-made also for the client. Next slide. And reliable also. The test result will be very accurate and reliable. And yeah. Next, smart devices. So we all wear watch, right? We all wear watch to just see the time or to maintain some other. But smartwatches are available nowadays, like to just to observe the cognitive performance of our own self. Like it could be like cognitive performance in the sense any impairment, mild impairment in case of dementia and Alzheimer's disease client patients and all, with the help of iPhone app and all. It's an Apple Watch. You can just observe it. And like mild cognitive impairment in the sense in the area of consciousness, memory, intelligence, abstract thinking, concrete thinking, all these areas, even orientation, all these areas can be just visualized. You can just see the reading in the watch. So like with this also, we can just bring new insights for the scientific world. Okay, next slide. Yeah. You can observe the picture here. This is patch. The person is wearing a patch in the abdomen, very near to the chest. And here, human stress monitoring patches It just monitors the skin temperature, skin skin the temperature and pulse wave, etc. And basically, this is a very good patch placed under the skin so that it signals that it states that how far you are tensed or some biosignal it can give to the emotional response or the monitoring. So it's a novel stress sensing patch. If you're stressed, if you wear this, the cortisol level can be read with the help of sweat glands. All these sweat glands will reveal the cortisol level so that it can be monitored with this stress patch. So healthcare worker can also apply this smart patches on chest and forearms. Basically, we just place it in forearm, of course, in chest also. Next slide. Yeah, this is electroencephalogram, EEG. So basically, EEG was found long back, 1929. And here you can observe like alpha, beta, alpha, theta, and delta waves. So it is basically brain waves. If you have any problem after seizure, or it is really an attack of seizure or any sleep problem, it can be monitored with the help of EEG, electroencephalogram. It is no more new. It is very long back. We are using till date. So it's an application to detect the sleep disorders, including insomnia or stress-related disorders, depending on the severity of the disorder. And here, as a healthcare worker, you can support the client and you can just explain about the procedure, how do we place the electrodes, and how far we trace, and how far we stimulate, or any anticonvulsants, or it can be for 24 hours before test. All those things can be just explained to the client, of course, for the relatives and bystanders. And some dietary stimulants like tea, coffee may not be withheld before each. It's not that too necessary. And we support throughout the procedure. Yes. With this, we are ending, I suppose. Next slide. Yeah. Any doubts you can throw them out.